Good afternoon, Mercer Island community. My name is Jessi Bon, and I am the city manager for the City of Mercer Island. Today is Thursday, April 2nd, and this is our live situation briefing. Today's agenda, I am pleased to welcome Officer Jennifer Franklin, our emergency manager. She has a number of updates for us on what's happening in our own emergency operations center, as well as things that are happening in the region and the state. From there, I'll provide a quick update on the total number of cases here on Mercer Island, clarifications on Governor Jay Inslee's stay-at-home orders, a number of city service updates, information on supporting our Mercer Island businesses, and a few shout outs and thank yous at the end. As a reminder, before we even get started, the city has activated a call center. It is one phone number that you can call for any of your needs. We realize as many of our departments are working remote, it's sometimes confusing to know what number to call. So just remember this number, 206-275-7626. And we're also happy to answer questions related to the COVID-19 response, the governor's orders, essential services, and anything else you might need assistance with. It's now my pleasure to welcome Officer Jennifer Franklin, one of our amazing staff talents that is leading us through this emergency. And Officer Franklin has a number of updates for us. Officer Franklin, welcome.
Thank you very much, and thank you, City Manager Bon. I'd like to start first with thanking all of our city staff. They have worked tirelessly throughout this incident. Then I also want to thank you as well, our community, for your thoughtful comments and also for the support of our businesses. I'm going to just start with basically talking to you about several different things, but reference to emergency management and how we're prepared. I want to brief you on what we've done so far, what we are doing, and how you can help. To begin with, we have been planning, training, and drilling staff and emergency volunteers for emergencies like this for 12 years. A lot of our staff would let you know that all of these drills and trainings I put them through, sometimes they may not be super excited about, but I can guarantee you, once this incident started and their very seamless transition into this emergency and how we respond to it has been wonderful. So I think now they're appreciative. All right. Let's go ahead, and I just want you to know that this incident came forward. I felt really confident about our plan that we updated in 2018 and our response to this. We work closely with our partner cities and King County, and throughout this emergency, we have and are continually available to each other and assist each other. So let's talk a little bit about what is working to combat this virus and how we can be a part of this solution. The first thing is social distancing is working. Hospitalization for patients with symptoms of COVID-19-like illness in Washington has declined last week by more than 20%. So in that, I know it's hard, and I have a 13-year-old at home that would like nothing better than to see her friends, but we have to continue to follow the governor's order and the public health guidelines. So when you are out in public, at the grocery store, on a walk, etc., you must maintain a distance of at least 6 feet. Number 2, we need to conserve medical resources. The people protecting you and helping you need this personal protective equipment to assist you. So it's imperative that we conserve medical resources. Call ahead before you go to your doctor. Telehealth is available at many locations, and telehealth appointments reduce the need for PPE. Continue to use 911 for emergencies, and if you can, donate PPE. There's a website with King County that you can go ahead and donate to. And the third thing, which is really important, that we can really assist with is donating blood. And a note about blood donations. Donation appointments are scheduled out throughout mid-April at this point. So we have had some people that have said, hey, I can't schedule an appointment till April 13th or April 14th. Please go ahead and continue to go ahead and make future appointments throughout the month of April and May, just to ensure that our blood supplies are replenished and stabilized.
So Jen, last week I had spent some time explaining that the city's operating under the emergency framework. So that means our old organization structure is set aside and we've reorganized under this new structure. One of the questions that came up, certainly there's a lot of interest in supply procurement, and we were asked a few times, how does it actually work? I know in an emergency, procuring supplies is one of our top priorities. So could you take a minute and just walk us through how it works behind the scenes?
Definitely. So just so you're aware of this too, this is not just how the city procures supplies. This is a national system called the National Incident Management System that the cities, the county, the state, and the nation all follow. So as an example, let's say a city staff person needs a resource and it's identified by them. They go ahead and take this resource and they put it up to the logistics chief. There's this org chart that you can see up there. So the green section there is what we call logistics. It's a pretty big section. It's a lot of work in there. And those are the people, I call them, they get stuff. The red boxes up there, it's operations, and those are the people that are the doers. They're the first responders out in our community, and those are the people that oftentimes need the resources. So they go ahead and they ask the green boxes, the logistics section, for this need, for this resource. The logistics chief will go ahead and confirm that resource and send it to the supply unit. City staff in the supply unit then are going to go ahead and order this resource and track it into the system. And so how this works is if, let's say, the supply unit gets this, they will first go locally. They will do their best to go ahead and try to find this resource within our own vendors, within our own city. If we can't, we may go to other jurisdictions to see if they have it. If that is exhausted, then we go up to King County. King County then will go ahead and look for it within the county. If they cannot find it, then it will go into, pushed up to the state of Washington. And then if the state doesn't have it, it will finally go ahead and go up to the federal government. And all of this is tracked through a system called WebEOC. All cities, counties, states, and the federal government all use this system. And what's interesting about this, and nice about this, is if for some reason they can look at all of the supplies where they're allocated. If the county or the state sees that there is more of a need in a different location, they can reallocate those supplies to a different location. So that's how it's tracked internally, but also through the county and the state.
Thank you. And so you'll hear throughout our presentation and probably in future days as well, supply procurement and ensuring that we have enough personal protective equipment for our police and fire personnel remains a top priority for us. Moving on to an entirely different topic, we have all heard about the field hospitals, and we have one going in at CenturyLink. So we received some inquiries from citizens. Can you tell us more about what's happening here?
Definitely. I call this kind of our fourth way of combating this virus, is asking for help from outside resources. And so what has happened in this situation is, the hospitals need beds, they need assistance. And so a request was made from the Department of Defense to have a field hospital. And so the first one that's being set up in the state of Washington is going to go ahead and be at CenturyLink Event Center. And it is coming in from the U.S. Army Corps of Engineers, FEMA, of course. And it will be a field hospital that will have probably over 200 beds at its completion for non-COVID patients from area hospitals. It'll free up beds for the hospitals and for staff as well. And so who's going ahead and supporting this are 300 soldiers from the 627th Army Hospital from Fort Carson, Colorado. The hospital is supposed to be up and running this weekend. Again, it's the first one of its kind, and 8 more supposedly are expected in Washington State.
Thank you for that update. Also, an inquiry we received is we understand the National Guard is deployed here or deploying here. Can you tell us about their role and what they'll be doing, at least for right now, what we know?
Definitely. So, and just so you're aware, this National Guard assistance did not come from the county or at all. This was from the Department of Agriculture request, and what it is to assist currently the food banks. So we have several food banks in Issaquah, Snoqualmie, and Kent that needed assistance, and so this request was put up through them to the Department of Agriculture. And so the National Guard is coming in starting April 7th, I believe, in Issaquah to assist the food banks. So that will be a really great assistance for those different areas as well. So that's, when you see them, that's what they're there for. It wasn't a request from county or the state.
Great. And we know the National Guard, their role could expand, but at this point, we don't have anything indicating that that is going to happen in the near future. Is that correct?
That is correct. Right now, it's just for the food banks. Definitely, they are able to go ahead and assist in any other way if the county or the state requested that.
Excellent. Thank you. I wanted to give you a chance to talk about our situation reports.
Great. So I consider this to be I have these all numbered because I'm a planner. This is our 5th way, I think, of combating the virus. And what this means is we provide these situational updates so that our key leadership can make informed decisions about what's going on. These reports, though, are also available to you through the Let's Talk page. So you can see as well what we're doing here at the city and how much work is really going into these efforts. I think behind the scenes, I think people see and they may not realize there's a tremendous amount of work that goes in at the city level and in the community as well. But to be able to make things work like this, so it's great to be able to see that.
Excellent. So I just want to put a plug in. If you would like to learn more about the city's emergency operation and even updates on things that are happening at the county and the state, go to our Let's Talk page. We publish situation reports on Monday, Wednesday, and Friday. And these reports, they're multi-page documents, so be prepared with your coffee for a long read. But it really gives you the inside take on what's going on behind the scenes. And again, those are available on our Let's Talk page, and we publish Monday, Wednesday, Friday. All right, we have a new local health order and directive that came out March 28th. Can you talk about what that means, what that did?
Yes, this right here, again, is just another way to go ahead and combat this virus. The governor's health order on March 28th basically is going ahead and giving new guidance for quarantine and isolation orders. And so what this means is a quarantine directive. This is for people with symptoms with a test result pending. They are directed to remain in quarantine while waiting for the test results. Now, the isolation order is different. People who have tested positive are to remain in isolation until no longer infectious. So that being said, there are some questions about, okay, so you want me to be isolated, or you're ordering me to be isolated. What does that look like? And so what the governor has done and what we in King County are doing to go ahead and assist with that is they've made 5 different locations available for people that do not have the ability to isolate at home. And so those locations currently are Issaquah, Kent. Eastgate won't open until around April 10th. And Seattle has 1 location that is open and another one that is on that will be opening soon. These locations are not publicized, but if you need to go ahead and make use of one of these locations, you can go ahead and call the King County help number, which is the 206-477-3977, and they can assist you with placing you in one of those locations if you need it.
Microphone. Officer Franklin, one of the questions that we had actually from many people last week, and it followed the presentation given by our medical director, Dr. Hal Quinn, is how do I prepare my family at home? What if I become ill? I know in my case, I have 3 young children, so they can't care for themselves if my husband or I become ill. You have some general guidelines here that you'd like to share?
So, and these are all from the CDC and public health in terms of the recommendations. I myself am a police officer, so I don't have the expertise to go ahead and give, health advice. But there's some amazing guidance from the CDC and public health. So the best thing you can do is isolate if you can. If not, follow the guidelines that CDC has put out to protect you and your family. They also have current advice for families who are not immune compromised. Again, it's staying at home if you're sick. Calling your doctor if symptoms get worse. Don't go straight into a medical clinic. Don't go to the hospital. Please call your doctor first. And then the last one was quarantine facilities that we just talked about. They are available, but do realize that there's limited space. So do your best to quarantine at home. But if that is not a possibility, definitely give that phone number a call.
All right, and you had a final message for us today.
I do. I have it up here, but I also have, just to begin with, is please be kind. Be patient with people. I tell this to myself too, so I'm not just saying this to everyone else. It's be kind, be patient, be compassionate. This is very difficult and stressful for a lot of people. People are out of work. People have their kids home and their whole families home in the same household, which may not have happened in quite some time. Please just be compassionate with each other, because we can get through this together, but we need to really just gear up and truly take that time to really just be caring. So know the facts, not rumors. There tends to be a lot of rumors floating around, Facebook, Nextdoor, etc. Know the facts. You can get the facts from our call center. You can get the facts from public health, CDC. There's a lot of facts out there, not rumors. Facts overcome fear. Please stay home. Stay informed. And we will get this through this together. I forgot the last little piece that says 6 feet apart, though. We have to go ahead and follow that. That's how we're going to get through this. And that's it. Thank you.
Thank you very much, Officer Franklin. You've heard me say repeatedly that the city is prepared and we're trained, and really much of that credit goes to Officer Franklin for her. I actually don't even know how many years you've been our emergency manager. I know it's more than a decade. And if at any moment I ever tried to get out of an emergency management training responsibility, she was in my office insisting I be there. And I'm thankful that you have taken it so seriously and prepared us for this emergency. So thank you very much. And I'll let you get back to it because I know you have a long list of things to do. Thank you. Transitioning now, I wanted to give an update on the total number of COVID-19 cases on Mercer Island. This is as of yesterday. As I was walking into the briefing today, we do not have the data for today just yet. As of yesterday at 3 o'clock, yesterday was April 1st, we have 43 confirmed cases and 1 person has died. That is for Mercer Island. In just a moment, I'll remind you about the public health dashboard. People with symptoms of COVID-19 are now required to quarantine. And according to the dashboard, about 230 Mercer Islanders have now been tested. So last week I reported on the dashboard that was made available by Public Health Seattle and King County, and you can see a screenshot of the dashboard. This was actually taken yesterday, again at 3 o'clock. In the text there, the number of positive cases in King County is almost 2,500. If you'd like to get the Mercer Island data, what you need to do is hover over the map and put your cursor over the Mercer Island, City of Mercer Island, and a box will pop up. That will tell you for our zip code 98040, the number of cases that we currently have. There is a little bit of a data lag still, and that is just partly due to the sheer volume. So I continue to compliment Washington State Department of Health and Public Health Seattle and King County for standing up this resource. When it went live last week, it immediately crashed because the demand was so high, and they worked literally through the weekend to get the back end stabilized so that we could have access to this data. So my thanks to them. So as I'm transitioning to the next slide, I think the chiefs will be making their way up here to prepare for their presentation. So a couple clarifications. Last Monday, to be clear, the governor issued the stay home, stay healthy order. I think by now we're all familiar with that. The order closed all businesses except those that were deemed to be essential. And certainly immediately after the order was released, there were many, many questions and need for clarification. In terms of construction, which has by far been the number one question coming to the city, is construction work is authorized to continue if it's for reasons to ensure the safety of a residence or a site, to avoid damage, or if it's for the essential use of a home. So some of the things that we've seen recently, we've had water heater replacements come up, furnace issues. We had a major roof repair that had to take place. We had a site over the weekend that had a structural issue that required a repair. Those types of things are allowed. We have a list of exemptions is available on our website, and this is on the city's website. We will make sure to get this information cross-posted on the Let's Talk page as well. Our planning department staff and our police department staff are working together to educate builders on the compliance with the stay-at-home order. And if you have any questions, whether you're a contractor or you're somebody that's observing work that is happening and you have a concern, the best thing you can do is call the Mercer Island call center at the number posted here, 275-7626, and we can triage that request. We would actually prefer the call come in here versus going to 911. So please use our call center if you have questions. In the background, in terms of construction, our planning department is continuing to do work, specifically technical review of applications. We're hosting pre-application meetings virtually, and we're continuing to inspect the work that is exempt from the governor's order. So there is some limited work still happening within our planning department. Also, if you have a concern about a business that is operating and it should not be, we have some abilities to enforce the governor's order. The police chief can talk more about that later. But the governor released information, and we've got it posted here, a website that you can go to express a concern about a business. So since we've been receiving so many calls and inquiries about this, we wanted to make sure this information was available to you. Okay, moving on now to Mercer Island City Services Update. Just a reminder, the city is an essential service provider. We perform a number of functions in the community that are essential and allowed under the governor's order. Certainly the emergency response, police and fire, roads, utilities, our mental health services. Our municipal court is not operating right now, but there are some limited functions that still occur. Parks are open on a very limited basis. And then we have staff that are still working almost entirely remotely in HR, IT, facilities, and finance, supporting the essential functions of the city. Most of our non-essential functions have been suspended. So parks maintenance, thrift shop, recreation programs, many projects, and we'll talk more about that in just a moment. I have a couple of utilities updates now. First of all, just a reminder, we have crews that are on standby or on call 24/7 to respond to your utility emergencies. We have had a few happen over the past month. We have a 24-hour call center line, and the number is posted here. We'll make sure this is shared widely again. It's 425-577-5656. This is the best way. If you have an emergency, a water leak, sewer backup, storm drain backup, call this number and somebody will be dispatched. If you send an email, we are not always monitoring our inboxes, particularly under these circumstances. Non-emergency repairs, and certainly because many of you are out and about taking walks, you may observe something that needs our attention, stop sign that might be down, something hazardous in a road or a sidewalk. You can submit non-emergency requests through our MI Connects program. It's a tool that allows you to report, and we can easily track. Some of this work won't be completed until the governor's orders are listed, but it's great to get it in and get it in the queue so that we can plan our future work. And this is just a friendly reminder, and I will thank a citizen that sent this to me. Do not flush wipes. Now, it seems silly that I'm bringing this up now, but I think household use of Clorox wipes and other types of wipes, and in my house, certainly, I have a child still in diapers, those types of wipes. Even the flushable wipes, please don't flush them. We've already had some issues in our sewer system. So you can help us out by throwing them away. Make sure your kids are throwing them away and not flushing them. And this prevents another emergency on top of the emergency we're already experiencing. So thank you for the citizens that have reminded me about this. Backflow testing, lots and lots of emails about this and some concerns about why the city is still requiring backflow testing. So give me a moment to explain, and hopefully we can find a way to support you in getting this work done. First of all, safe drinking water is a top priority of the city, and we don't want to compromise on those standards. It wasn't too long ago that we had a boil water event, and we do not want to have that happen again. So completion of your annual backflow testing remains a requirement in 2020. We ask that every reasonable effort be made to complete your backflow testing by June 30th. Most of the backflow assemblies are actually outside, and the backflow testing companies, they're prepared. They have all the safety protocols. They can come and do the testing, and then they just submit the paperwork to us online, so minimal contact. Now, I know the concern really isn't with the outdoor backflow assemblies. It's with those that may be inside your home, particularly water filters and things like that. So what we encourage you to do is call your backflow testing company and talk through the scenario. They may have a solution. I know some of your backflow assemblies are actually in your garage, so there may be a way to complete that testing safely. If it turns out that the backflow assembly is in your home and you just are not able to do so right now, that's fine. We are working through a code amendment that will suspend the fines for missed backflow testing, but we really do want this to remain on your radar to complete in 2020. So we're working on a strategy to allow a grace period, particularly for backflow assemblies that are inside your home. And given the number of calls and emails we've received on this topic, what I will suggest, because each situation is truly unique, give us a call at the call center, and we can work through your specific situation. Again, that number is 275-7626. And now it is my pleasure. You guys are sitting in different seats this time, keeping me on my toes. It's my pleasure to introduce Fire Chief Steve Heitman. Chief Heitman?
Good afternoon, Mercer Island. I'm very happy to report that the Mercer Island Fire Department is still at full staffing levels at this point. None of our personnel have been taken out of service due to COVID-19 issues, and we don't have any confirmed exposures from the calls that we've been answering. Right now, we're still at a good supply level for PPE, but that is always in the back of our mind, especially as we're hearing throughout the country that it is in short supply, that the national strategic stockpile is getting low. And so we've been looking for a number of ways to acquire that, as well as how can we extend the use in a safe way. current priorities that the state has given to the county, or the county has determined, is that when they receive a shipment of PPE from the state, that 75% of that shipment goes to the hospitals and the medical facilities. And then fire and EMS receive about 17%, and the long-term care and skilled nursing facilities get about 7%. We're working with the Department of Public Health on those numbers. We believe that we're going to require a larger portion of that, not to take anything away from the hospitals, but because of the amount of encounters that we have with potentially infected patients. We're also looking at ways to take up some of the offers that have been put out there through various people within the community on donating PPE or helping us acquire it. We're also looking into extending the use of masks and gowns through disinfection protocols, especially UV light. We're looking at disinfecting those items if we've been on a call where COVID-19 is not suspected for that, so that we can use them more than just for brief periods. So we're hoping that that's going to help. Good news is that the disinfecting machine that we ordered has come in early, and so we just started to use that on the fire stations so that we can get better control there. One of the things that we're asking from the community is for you to help us stay safe. So please be honest about the symptoms that you're experiencing when you interact with a firefighter or any other public safety official. We're still minimizing that contact with the outside if it's on a non-call basis. And as I stated last week, we've implemented well checks for the firefighters, and so we've had great success with that. We think it's one of the reasons why we're not getting exposures within the department, is having our people be very concerned about their own health and keeping an eye on it. And we have not, at this point, had to require anyone to go home from duty. Everybody's been showing up healthy. On a regional note, the King County Fire Chiefs and King County EMS developed a joint letter that we have sent out to all the long-term care facilities and skilled nursing facilities, letting them know what we're doing and the steps that we are taking to make sure that our personnel are not bringing anything into their buildings. In some of these facilities, firefighters have experienced being stopped at the door and being asked to take a temperature check and answer a number of questions prior to getting in to treat the patients. And so we're providing that information so that we don't have a delay in care, which we've already experienced a bit just because we have to put on more PPE. So we're hoping for great success with that as well. On a brighter note, these types of events tend to bring out the best in most people, and that includes great innovation and a greater use of technology. So for good news, the University of Washington is looking at producing face shields, which will help out with the PPE issue, and producing those via a 3D printer. So and they're also looking at doing masks, and we're very excited to see how this turns out. The question will be how many can they turn out as well. There's also an engineer out of Kirkland who's looking at the potential of washable gowns. And he is currently working with a lab to test this, and we hope to have a demo model pretty soon, which will make a huge difference if we can get a stock of these, throw them through the washer, and then put them right back on when the firefighters go on calls. Good news, what do we know is there are now multiple sites set up around the county for first responders to get testing so that there isn't a waiting period and we can get them tested as soon as possible and determine whether or not they're positive for COVID-19. For the citizens, if you are displaying symptoms, contact your healthcare provider and set up an appointment to get tested for that. That is still the best way to do it. Multiple municipalities have requested to set up their own test sites, but the Department of Health requires all testing be coordinated through them and has discouraged that. There are also swab kits that we are hoping will arrive soon, but as to a time frame, we don't know when that will happen. And then lastly, beware of scams and false promises online. If it sounds too good to be true, it probably is. Give you an example that I have heard from one fire department, not in this part of the country, was they were promised that they could be delivered PPE on a drop shipment within a week if they paid up front. They paid up front, and there is no drop shipment to be had. So it's at all levels. just beware of that. Thank you. Oh, I'm sorry, one more section. What can you do? We've talked about it before. Stay at home. Keep that physical distance. Even when you're at home, try and practice that. Keep up with your outstanding hygiene, so wash your hands, clean up those high contact points. Continue to keep a positive attitude and continue to seek out opportunities to volunteer or donate as they arise. As this goes on longer and longer, we're going to need those more and more. Right now, as I've said, we are set up well, but as this wears on, we're going to need that. And just to let you know, we do greatly appreciate all of your support.
Chief Heitman, before I let you go, may I ask how the firefighters and the fire administration is doing?
Everyone's attitudes are great. This is our business. This is what we do. What we've really had to do for this is just to establish those protocols that are going to keep us safe. We've had to up the level of PPE. The stress comes from whether or not we have the supplies and or the products, but we've also been very successful in putting in new processes that everyone has done a fantastic job of adjusting to. The stress on admin is a little bit higher because we're trying to learn how to do our jobs not in our office, which we've been very comfortable with doing. And so telecommuting is slowly being embraced, but we're really doing well with that.
Thank you for that. I certainly get a number of inquiries. How are your staff doing? And I can't even physically go say hello to the fire team. So please give them our best on behalf of the Mercer Island community, and thank you for all that you're doing for us.
Absolutely. Thank you.
I'm now pleased to introduce Police Chief Ed Holmes, and he has a police operations update for us. Chief?
All right, well, good afternoon. Ed Holmes, your police chief. And I am pleased to start my report by saying that all of our police officers are healthy. We are all exercising good precautions to include use of PPE. As recently as this morning, 2 of our officers went to a call with the fire department and they donned or put on their PPE with the help of fire, so we appreciate that help with fire department there. And another example of the 2 departments working well together. If you'd like to see some pictures of the PPE being worn by our officers, you can jump on our Facebook page, the Mercer Island Police Department Facebook page, for some good pictures. You'll see one of our brand new officers with his field training officer with their PPE. I'd like to spend a few minutes now talking about the governor's stay-at-home order. I am pleased to say that most people are complying with the order. Officers, as I mentioned last week, are focused on education, helping people understand what does this order mean, what does it mean to the individual specifically, and how to comply with the spirit of the order. We are urging voluntary compliance, and voluntary compliance is not to be confused with optional compliance. This is not optional, and you do need to follow the governor's order. Now, repeated violations of the order can result in criminal citations and or arrests. But let me be clear, we do not want to have to do this. So I'm asking all of you to not put us in the position where we would have to do that. So that's on you to make sure you're not putting us in that position. Islanders, you need to continue doing your part for everybody. We have questions about some businesses that come to the island. You know, half of the equation is the business themselves if they come to the island with contractors, for example. The other half is the island residents who are continuing to employ or invite the contractors to their place. So if it's not essential work, do your part also and just simply postpone the work that would otherwise take place at your house. Now, essential work is defined as essential to prevent damage, essential to address unsafe conditions, or essential for making emergency repairs. And if you are in doubt or have questions as to whether or not the work is essential or not, you've heard this number before, I'll give it to you again. Call the city's hotline there at 206-275-7626, 206-275-7626. The only way we're going to get through this is if we all do our part, and that includes, as you've heard a number of times, the notion of social distancing. We still hear reports of people in the parks gathering too closely together. I heard a report this morning of people walking along the roadway, specifically the Mercer ways, in groups that are too close together and in the roadway itself. So 2 concerns there, being too close together, and the second, of course, being in the lane of travel is not safe. So I need you all to do your part in the social distancing, and then when you are on walks, make sure you're walking in places that are safe outside the lane of travel. So I will say, as I said earlier, most people are doing their parts. We've heard of and seen some wonderful examples of people stepping up, coming together to help out their neighbor, their emergency workers and their first responders, nurses, doctors. We see it all over the news, and I'm very pleased and encouraged to hear that and see those examples. So just impress upon all of you, encourage you all to continue doing your part, and we will get through this. Thank you.
Thank you, Chief Holmes, and I want to pose the same question to you. Can you tell us how your officers are doing, how the police administration is doing? I know I've seen you on just a very limited basis. You're working hard, and we care about you, so how are things going?
Well, thank you. I appreciate that, and I appreciate the question. All of the officers, morale continues to be high during this, and we all understand that this is what we signed up for, maybe a little more than we signed up for, but this is the type of work, as the fire chief mentioned, that we're accustomed to dealing with. We work in the emergency environment, so the officers are doing well. Our detectives, for the most part, are trying to telecommute to the extent they can. Our record staff are doing the same. Administration, we try somewhat unsuccessfully to telecommute, but we're all just pulling together and working hard to make sure we get our mission done.
Thank you, and I will share the same message. We can't say our thanks to you in person or to your team, so please extend a heartfelt appreciation from the Mercer Island community to your entire team. And thank you both, Chief Heitman and Chief Holmes, for participating in the briefing again this week. I will move on now to a handful of other city service operational updates. The first one is from the Community Planning and Development Department. We have suspended the following activities until a date to be determined. It's likely the fall of 2020 or possibly beyond. So we have suspended our legislative work in the planning department. This is things like the town center, the sign code, the small cell code amendment, and things that fall into that category. Public hearings that have to occur either before the hearing examiner or the design commission are also suspended. We actually can't have public hearings right now per the governor's order. Inspections for work that is not allowed under the stay-at-home order from the governor are also suspended. And we're no longer issuing public notices because of the work that I just mentioned. So some things particularly that are impacted, I want to be clear, design review for new construction is not happening right now. Subdivisions, including short subdivisions, any review work related to that. Shoreline permitting, including shoreline exemptions, and new home construction and major additions or remodels of existing homes are all suspended at this point. So some of the projects that are shown on this slide are specifically impacted, and you've probably been wondering why we haven't been able to be more specific. When the governor's order came out, there was some uncertainty about when it would be lifted, how it would be lifted, and so we're still working through all of that behind the scenes. Here's what I can tell you, Mercer Island community, there won't be any surprises. When the work resumes again, we will provide you with ample notice, and I have to assure you, most of the staff resources right now are focused on the emergency response. So we have to, we'll have to be in a position to resume this work as well. We're in the process of updating our website and our Let's Talk pages. I still can't say for certain when the work will resume. That's one of the challenges of this emergency is we're functioning on a week-to-week basis. But again, I have to say this, there won't be any surprises. So nothing will just magically reappear with no notice. We will give the community lots of advance warning, particularly with public hearings and public comment and the like. All right, public records requests. Our public records processing system is modified per the governor's order. We no longer accept in-person requests, and you can't come to City Hall right now to pick up or copy documents. We've also, the governor's request, suspended the requirement that we provide you with an initial 5-day response when we receive your request. And that's because of resources right now. And I will mention of the 4 or 5 staff that we have working on public records requests, a number of them are deployed and working on document tracking for the emergency. So our resource levels are down. But that being said, you still, if you have a public records request, our portal is open 24/7, and we encourage you to go there and submit it. That is the preferred method for a public records request. And even though I just mentioned our resources are redeployed, working on other things, we are working on public records requests. So work is still happening as time allows. And thank you for your understanding and flexibility on that. One of the projects we have suspended is the Parks, Recreation, and Open Space Plan, the PROS plan. This is another item I've been receiving a number of emails about, asking, you know, is it done? Is it going? So here's what I can tell you. This particular project, it's a strategic plan, and the foundation is really based on having a robust community engagement process that we just can't do right now. So this project will be suspended until at least the fall, and likely into 2021. For those of you that follow city government closely, you'll know that this fall we have to work on our, we'll be working on our 2021-22 budget, and that will be our priority. So even though we're anticipating being able to resume some work in the fall, I think most of our major projects will probably slide out until 2021. Some things you should know about our major projects. The PROS plan is a good example, is this project is tied to a contract. And so we're working behind the scenes right now with our contract, with our contractor on what the suspension looks like. If there's any work they could possibly do right now that doesn't involve the community engagement component. So there's just a lot going on behind the scenes. We have a very long list of contracts. We have a very long list of projects. And I thank you for your patience as we're continuing to work through those list of items. We will be, again, updating our Let's Talk pages in our website so that that information gets out there. I do have a few updates from regional and state partners. The first one is from the Department of Licensing. They announced this week, or maybe it was the end of last week, that they would be closing all lobbies to the public, and that started on Tuesday. So if you had an appointment with the Department of Licensing for renewal, all appointments are canceled, and the renewals are all taking place online. On this slide, we've given you a few phone numbers that you can call if you have questions about a licensing need. Business licensing assistance. Again, the State Business Licensing Service, also known as BLS, is temporarily suspending the automatic termination process for expired license endorsements, so allowing a grace period there. And I understand that when they do issue licenses for Mercer Island, late fees will be waived. So if you have questions, reach out to BLS online or by phone. Also announced last week was the cancellation of MercerFest. Some of you know that a community group, just a really wonderful group of community volunteers, had come together, and they were planning a event in July to celebrate the city's 60th birthday. One of the quotes they provided us was, "We will find a way to celebrate as a community as soon as we can." The current circumstances are making the planning for the event and resource availability just very challenging. So they made the decision to cancel. We're encouraging everyone to work on their social distancing so that we can have a makeup 60th birthday party next summer. And again, I want to say thank you to really the incredible group of volunteers that came together and we're planning this event. I hope all of you will stick around and work on it next year. Mercer Island City Council meetings. So we will have a City Council meeting virtually on April 7th. There has been a fantastic amount of work happening behind the scenes on how to do this meeting. And to comply with the governor's order, It will be entirely virtual by video conference. We have a phone number that you can call in and listen. And agenda items are limited to only those things that are necessary and routine for the city's business and or to respond to the current public health emergency. I didn't include a slide here in terms of what we'll be covering on Tuesday. The agenda will be out hopefully later today. You can expect information. We have payroll and claims that need to get processed. We're looking at a B&O tax deferral option for businesses. We'll also be asking the council to identify basically a successor to the mayor and deputy mayor in case they're not able to perform their duties. So that's coming soon. The meeting, as always, will be streamed and broadcast live on the city's YouTube channel. So the same way you're watching this briefing now or on channel 21. We will have a phone number that you can call in and listen if that is your preferred option. And public appearances will not be included in the agenda for this first meeting. However, we are accepting public comment on our Let's Talk page. I'd like to transition now to an update and on the work we're doing to support our Mercer Island businesses. Thank you all. I know everybody is working hard to purchase meals and do whatever they can to keep our business community going. This is an update on special shopping hours. New Seasons Market, a reminder, if you are a senior or you are somebody that is in an at-risk population, many of our retailers have adopted special shopping hours for you. New Seasons, it's 7 to 8 a.m. all days. QFC, both locations, north and south, 7 to 8 a.m. Monday through Thursday. Walgreens, 8 to 9 a.m. on Tuesday, also offering a senior discount. And Rite Aid, 9 to 10 a.m. Monday through Friday. I need to give a shout out again to Councilmember Salim Neese for working on this project over the last many weeks. You would be amazed at how much work went into going all the way up the chain with these retail partners here on the island. And also, he has made himself available to support other cities who are still working with their retail partners to establish special shopping hours. So thank you very much, Councilmember Neese. The CARES Act that was recently passed by the federal government included almost $400 billion for small businesses in loans, grants, debt relief, and other programs. A lot of information is still coming out about the CARES Act and how it works. We are actively gathering that information and posting everything that we're receiving on our Let's Talk page, including program overviews, frequently asked questions, tutorials, and many links to free webinars. So if you are a business here on Mercer Island, please go to our page. And if there's anything else we can help with, we will absolutely do our best. We know the information, there's a lot of information and it's coming in very fast. As a reminder, we have a Takeout Tuesday campaign that launched last week. This does not mean you should just take out on Tuesday. This is the day we really want you to promote your takeout choices. On Tuesday, I will say we ordered from Haps. My family did. That's the old 76, and we had a delivery within 15 minutes to our home. So it's really good food too. Anyway, that's something that you can do to continue helping support our businesses, and we want you to take it a step further. When you do order out, use your social media accounts and promote the business that you're supporting. That's one way we can help get the word out. My thanks to everybody that's working on this behind the scenes, the small businesses that are hanging in there right now, the Chamber of Commerce, our city council members, who every single one of them is engaged in this effort, and our staff person, Sarah Bluvis, as well as many other volunteers. Thank you. Before we finish our briefing, I wanted to take a moment to thank one of our heroes, somebody that you don't see very often because she's working behind the scenes. If you visited the community center anytime over the last decade or more, you probably know our custodian, Debbie Kaiser. She came to work with us in 2005, and her job is actually at the community center, and she works there generally during the day. About a month ago, we went to her and said, we need help in all of our buildings. And so since that time, she has been cleaning and disinfecting all of our facilities. And I'm glad the police chief is still here today, because one of the departments that she is keeping going is the police department. She does high-touch cleaning. So if you could imagine, she's going through the buildings and following around the police officers and making sure that they stay safe. And she does her work with a smile on her face, and she has been incredibly reliable. Chief, would you like to give a shout out to Debbie?
Yeah, yes, thank you for that opportunity. So I see Debbie almost every morning, at least the mornings I'm there, and she is working hard with a smile, like you say, and I just let her know, and I wanted to let her know now just how much she is appreciated by all of us. For doing that work. It is behind the scenes work, but it really truly does help keep all of us safe and able to provide the service to the community that we may not otherwise be able to. So my hat is off certainly to Debbie. Thank you very much.
Thank you, Chief. So I have an ask, Mercer Island community, since we're social distancing now, if you have a moment, could you just send Debbie Kaiser thank you from the community? I think she would love to hear from you. She's probably going to be really mad that I did this. Her email is first last name, so it's debbie.kaiser@mercergov.org. And Debbie, from all of us, thank you for keeping all of our buildings running during this emergency. I'd like to finish this briefing with a little bit of fun. From our friends in the Parks and Recreation Department, if you go to the Parks and Recreation Facebook page, our mascot, Leap the Frog, has an April bingo card for you to play with your family. We encourage you to check it out. Also, a thank you. When this emergency started a few weeks ago, we were having some challenges in our parks, but we are observing that social distancing has gotten much better in our parks, and we thank the community for your help with that and for setting a good example. Also, I thought I would tell you that one of our staff came to City Hall the other day and discovered that the Elves were busy at work. You can see they're playing around with the copy machine and even dipping into the precious hand sanitizer reserves. So we will be keeping an eye on these elves, and I'm sure all the parents out there are really appreciative that we just showed an image of the elf on the shelf. Anyway, we'll keep you posted on what the elves are up to in the coming weeks. All right, a final reminder, we have a call center. If you need anything, if you're not sure who to call, use this number, 206-275-7626. If we can't answer your question, we will track down that answer for you. And another reminder, we have a variety of social media pages, so go out, Facebook, Twitter, the main city pages. We also have Emergency Management Facebook page, Parks and Recreation Facebook page. Please give us a like, and it's one way you can stay connected with the city during the emergency. We will be back here again next Thursday at 3 o'clock, and I thank you again for joining us today. If there's anything that we can do, anything you'd like us to cover, questions you have, please drop me an email at citymanager@mercergov.org. Thank you, and have a good afternoon.